In part 1 of How to Cure Chronic Pain and Depression, I shared how I personally struggled with chronic symptoms, the infuriating apathy in the medical system, and the helplessness of feeling isolated from friends who just didn't get it, and how this led me to becoming suicidal. And now I want to share how I made a full recovery in a week. So there I was, after being disabled for 2 years and at the end of my rope, when an acquaintance recommended I read Healing Back Pain by Dr. John Sarno, whose research in the 70s discovered the real cause for why most people have chronic symptoms. While reading the book, I started having nearly every symptom at once and realized that he was right. My symptoms were not from an organ disease or structural abnormality. My symptoms were caused by stress, trauma, and repressed emotions. Within a week, all of my chronic symptoms went away. I no longer felt helpless, and the rage and anxiety began to fade. I wanted to keep living because now life felt worth living, and I knew I had to help others who were in my situation, so I created this YouTube series. If you are in chronic pain or disabled by symptoms in some way that doctors can't figure out or help you with, the real diagnosis may not be what you think. Like me, you may have Tension Myoneural Syndrome, also known as psychophysiologic disorder, mind-body syndrome, or stress illness. TMS is a reaction to stress, trauma, and repressed emotions that cause a change in the nerve pathways in the brain. This leads to chronic disabling symptoms, like extreme pain, that can actually be cured without drugs, surgery, physical therapy, or alternative medicine. In fact, these body-focused treatments will cause TMS to continue and get worse by not treating the problem at the source and reinforcing false associations with things that aren't the cause of the problem. Awareness of TMS can relieve symptoms by improving your recognition of the power of past and present stressors in your life. This recognition will also help prevent future relapses of TMS as you comprehend and learn to cope with those sources of stress. This means that things which once hurt to do, like sitting, can stop hurting, and things that were impossible to do, like more strenuous physical activity, can be possible again. So here's what you should do now. Learn more by visiting ppdassociation.org and tmswiki.org, where you can find a directory of practitioners to evaluate if you have TMS. You can even start getting better from home by using the resources I provide in my YouTube series. Recovering from TMS is easy for those who are good at visualizing and communicating with their subconscious. For those that need more guidance, and it's okay if you do, you should just consult with a therapist familiar with the TMS approach. TMS practitioners excel at empathy and actually take the time to listen to their patients, describe not just their symptoms, but what is going on in their lives to get to the source of their symptoms to cure them. Please don't think that you have to fix everything in your life or suddenly become stress-free in order to reduce symptoms. My symptoms went away as soon as I fully understood what was, and more importantly, what was not causing them, and continued to think psychological, not physical. The less I gave into symptoms, the faster they went away. Then and only then did I have the capacity for the emotional work to cope with past traumas. You can and should take your time with that part. If there is even a chance that your chronic symptoms could be caused by TMS and you're depressed or contemplating suicide, you have nothing to lose by learning more about TMS. Watch my videos, check out the resources I provide, and see a TMS doctor to get evaluated properly. I know how hard it is to suffer with chronic pain and suicidal thoughts, and now I want to do everything I can to help others who I know are out there suffering from the same symptoms and getting the same crap treatment I did. There is another answer. TMS awareness can be the permanent solution you're looking for. Please share this video with anyone you know who is suffering with chronic pain and depression, and subscribe to my YouTube channel to learn more about Tension Myoneural Syndrome and what you can do right now to take back control of your life.